Good afternoon and bonjour à toutes et à tous. Today,
Hello, everyone.
about the impact of the pandemic on the ongoing crisis of drug overdose deaths in Canada. But first, I'll start with the usual numbers. There have been 126,848 cases of COVID-19 in Canada, including 9,102 deaths. 89% of people have now recovered. Labs across Canada have tested an average of almost 48,000 people daily over the past week, with 0.7% testing positive. Currently, Canada is testing more than 140 people for every positive case. An average of just over 400 new cases have been reported daily during the most recent 7 days. Tragically, in many regions of the country, the COVID-19 pandemic is contributing to an increase in drug-related overdoses and deaths. There are indications that the street drug supply is growing more unpredictable and toxic in some parts of the country, as previous supply chains have been disrupted by travel restrictions and border measures. Public health measures designed to reduce the impact of COVID-19 may increase isolation, stress, and anxiety, and put a strain on the supports for persons who use drugs. As you might have read or heard earlier this week, the number of drug overdose deaths recorded in British Columbia has exceeded 170 for the third consecutive month. This represents a 136% increase over the number of deaths recorded in July of last year. This isn't just happening in British Columbia. There are reports of an increase in overdoses in other communities across the country. Yukon reported twice as many overdose deaths in the first half of 2020 when compared with the same period in 2019. Saskatchewan is reporting historic levels of overdoses and overdose deaths, and in Quebec, July saw the highest number of overdose deaths in Montreal in over 5 years. People use substances for many different reasons, such as a means of coping with trauma and other pain. For some, substance use can have negative impacts on their life. We know that addiction is not a choice. It is a treatable medical condition, and that there are many different paths to wellness and recovery. I encourage those in a position to support people who use substances to explore all of the options at their disposal. Evidence shows supervised consumption sites help save lives, connect people to social services, and can serve as a pathway to treatment. Providing flexible treatment options, such as methadone or other opioid agonist therapies, or a safer alternative to street drugs for people with substance use disorders, are also ways to help reduce the risk of overdose, infection, and withdrawal. In these difficult and unprecedented times, it is important that we recognize substance use disorder as a health and social issue, and that we treat people who use drugs with compassion and provide them with the support they need. Visit canada.ca to learn more about what you can do to help save a life, such as recognize and act if you witness an opioid overdose, or change the way you speak about substance use so others feel supported to reach out for help. Check in regularly on co-workers, friends and family who may be living alone or working from home. These actions can help save lives, especially given the compounding public health impacts of the pandemic. Thank you.
Bonjour.
Good afternoon. Today I'd like to talk about the impact of the pandemic on the ongoing crisis of drug overdose deaths in Canada. But first, as usual, I'll start with the latest figures. There have been 126,848 cases of COVID-19 in Canada, including 9,102 deaths. 89% of people have now recovered. Over the past week, labs across Canada have tested an average of almost 48,000 people daily, with 0.7% testing positive. Currently, Canada is testing more than 140 people for every positive case. An average of just over 400 new cases have been reported daily during the most recent 7 days. Tragically, in many regions of the country, the COVID-19 pandemic is contributing to an increase in drug-related overdoses and deaths. There are indications that the street drug supply is growing more unpredictable and toxic in some parts of the country, as previous supply chains have been disrupted by travel restrictions and border measures. Public health measures designed to reduce the impact of COVID-19 may increase isolation, stress, and anxiety, and put a strain on the supports for persons who use drugs. As you might have read or heard earlier this week, the number of drug overdose deaths recorded in British Columbia has exceeded 170 for the third consecutive month. This represents a 136% increase over the number of deaths recorded in July of last year. This isn't just happening in BC. There are reports of an increase in overdoses in other communities across the country. Yukon reported twice as many overdose deaths in the first half of 2020 when compared with the same period in 2019. Saskatchewan is reporting historic levels of overdoses and overdose deaths, and in Quebec, July saw the highest number of overdose deaths in Montreal in over 5 years. People use substances for many different reasons, such as a means of coping with trauma or other pain. For some, substance use can have negative impacts on their life. We know that addiction is not a choice. It is a treatable medical condition, and that there are different paths to wellness and recovery. I encourage those in a position to support people who use substances to explore all the options at their disposal. Evidence shows supervised consumption sites help save lives, connect people to social services, and can serve as a pathway to treatment. Providing flexible treatment options such as methadone and other opioid agonist therapies, or a safer alternative to street drugs for people with substance use disorders, are also evidence-based ways to help reduce the risk of overdose, infection, and withdrawal. In these difficult and unprecedented times, it's important that we recognize substance use disorder as a health and social issue, and that we can treat people who use drugs with compassion and provide them the support they need. Visit canada.ca to learn more about what you can do to help save a life, such as recognize and act if you witness an opioid overdose, or change the way you speak about substance use so others feel supported to reach out for help. Check in regularly on coworkers, friends, and family who may be living alone or working from home. These actions can help save lives, especially given the compounding public health impacts of the pandemic. Thank you very much.
Thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking question in the room, we ask that you make your way to the freestanding mic. As usual, we will start on the phone. Over to you, operator.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez, s'il vous plaît, appuyer sur étoile 1 maintenant pour poser une question. And the first question, la première question est de Jim Bronskill from the Canadian Press. Please go ahead. Your line is open.
Hello, good morning, Dr. Tam. There's a new directive out today from Ontario. It suggests a chief medical officer's decision will take precedence over that of a school official in school settings. Should health officials or school boards have the final say over any pandemic school decisions?
think that's obviously a matter within the provincial jurisdiction. I would always expect chief medical officers to work with school boards, but I think there are different legislation, public health acts within different jurisdictions, so that's best answered by the provinces themselves. However, what is completely evident is that schools need plans, and those plans must sort of entail a very good discussion between school boards, teachers, parents, and the public health, local public health jurisdiction as well, and to ensure a return to school that is as safe as possible.
Jim, follow up?
Yes, thank you, Dr. Tam. Another question for you. Quebec is announcing that people with symptoms of COVID or who test positive for COVID-19 must now isolate for 10 days instead of 14. Do you support this directive, and will you recommend that other provinces do the same, if so?
Yeah, so I think it's an opportunity to just clarify what that infectious period actually is. So with the Special Advisory Committee, we had previously already discussed this recommendation, and it is something that's already been published, and what Quebec has communicated today aligns with the existing guidelines that the Public Health Agency has already published in working with the provinces and territories. So what we're talking about is not the isolation period from the perspective of quarantine. So in quarantine, we're talking about the incubation period, during which time someone could become symptomatic. And that is up to 14 days. And our period of quarantine has not changed to date. What Quebec is talking about is what we call the infectious period. So someone who actually has COVID-19, and if they are completely recovered, they don't have symptoms, and they don't have fever, and it's been 10 days since the onset of the symptoms, our recommendation is that, based on the evolving science, that those who've sort of experienced 10 days post onset of symptoms, asymptomatic, have no fever, can come out of the actual isolation. So a number of other jurisdictions are already doing that. And so Quebec is just joining others.
Thank you, Doctor. Before we move to the next question, Dr. New, could you repeat this response in French, please?
Okay, merci.
Thank you very much for that question. I think there's a bit of confusion between what we call the incubation period and the infectious period. We've had really good discussions already on the Special Advisory Committee about this, and everyone agrees with our counterparts across the provinces, and including Quebec, and what the evidence has shown is that a person who is infected with the virus, who's had COVID-19, they will be contagious to others for at least 10 days, rather 10 days, after the apparition of symptoms. This is the incubation period. And that's why it's maybe not clear for everyone, but for us it is. Someone who's already had COVID-19, if they no longer have symptoms and they're in good health, 10 days later they see symptoms, they can leave isolation. But this is different from the incubation period. In terms of the Quarantine Act, it's different because the incubation period is different. The person should no longer have symptoms. This is up to 14 days for the quarantine. Thank you.
Next question.
Thank you. The next question, la prochaine question est de Michel Lamarche de TVA. Please go ahead. La parole est à vous.
Bonjour, monsieur.
Good afternoon, Mr. New. I'm not sure after your answer there's no longer confusion about this. I'd like to be more specific. 10 days after the onset of symptoms, or it's 10 days after the last symptom experienced by the person. Quebec seems to be saying something different this morning. What we discussed on the Special Advisory Committee is that if someone falls ill with symptoms, 10 days later after the onset of initial symptoms, this person is no longer contagious after 10 days if they're in good health. It's not after the last symptom. No, it's from the beginning of the onset of symptoms. According to evidence to date, this person would no longer be contagious. Is that clear? From the beginning of the onset of symptoms. This is different because if you're talking about the incubation period, if someone is exposed to the virus, it could take up to 14 days for symptoms to appear. There are two different periods we're talking about, the incubation period. Well, and then if you're already sick with COVID-19, the onset of symptoms, well, then we wait 10 days after it's contagious, and then they can leave isolation. Thank you. Michelle, follow-up question. Of course. Quebec today, with its announcement, is respecting the science which has infusion in Canada. Would it not be, therefore, better to be on the same page federally so that everyone is aligned? You were saying that some provinces had already implemented this 10-day measure. Yes, we've had good discussions. Well, 4 months ago we discussed this. There may be some confusion in terms of the 14 days. I understand this because there could be some confusion between the incubation period and the isolation period after the onset of symptoms. Some provinces, such as Quebec, were more conservative, and they used the same 14 days for the isolation period and the incubation period. But now, we're in place than we were before. Quebec has announced for its province, for a 10-day period after the onset of symptoms. But there already have been a few provinces, for example, British Columbia, that has always used the 10-day period after the onset of symptoms. We've already discussed this thoroughly on the Special Advisory Committee, and there's no change here. Everyone agreed that the infectious period was up to 10 days. It's always up to the various provinces and territories to decide on this. But if a province wants to be more conservative, they can have a longer period. Thank you, Dr. New.
Thank you. Merci. The next question, la prochaine question est de Maliha Sheikh from City News. Please go ahead. Your line is open.
Thank you. So currently, international travelers coming into Canada have to do day quarantine. And of course, this even applies for some travelers within the country. Are we possibly looking into alternative measures, such as completing COVID-19 tests at the airport so that people can get their results within 24 to 48 hours and then they don't have to self-isolate?
So you're correct that we still have a requirement for 14-day quarantine with some exceptions. And that is sort of proven to work as a public health measure. But absolutely, as we look at options going forwards and, sort of reducing the more restrictive measures at the border, how we apply testing in that context is being actively explored. And I think that there was some communication earlier on some of the testing protocols that could be implemented to I think initially get us a bit more data on, what happens when we test travelers at different time periods after they enter Canada, to see if those studies will yield us some information that we can then apply more broadly. And so absolutely.
Follow-up question?
Is there a timeline on this?
Not at the moment, but it's, we actually have to, of course, have collaboration with local and provincial public health and other partners. And it's not just a matter of the sort of public health science, if you like, but also implementation or operational requirements, given how that border is an extremely busy place where you have to sort of look at what is the best site for doing testing as well. So all of that goes into the consideration as we review the options.
Thank you, Doctor. We'll now turn to the room. Première question dans la salle. Lina?
Oui, bonjour, Lina Dib, la presse canadienne.
Hello.
To me, Dr. Tam, because you were in that train of thought now. So it's 14 days of incubation. So why would it be okay to test a traveler after 2 days, and if his test is negative, to let him go out? I don't quite understand the science of it.
I did not say that would be the protocol. And of course, what you just said is the limitation of testing at a moment in time. So there'll be sort of different proposals that people are putting up where you do serial testing, for example. That might be one option that we could look at, not just on day one, but further down the road, just to see what the results might be. So no, we have not landed on any kind of testing protocol at this point, but we're exploring the test parameters and the limitation of those tests. But what you've hit on is exactly the issue, is that if you test someone at a particular moment in time and they're negative, that doesn't mean that they don't have the virus, which is why we still have that 14-day as the strongest public health measure. But we realize that, in living with this virus, as we progress in the knowledge of the virus, but also maybe different testing modalities that will come on board, we need to revisit this issue on a very real-time basis.
Okay. Mon autre question était...
My other question was for you about this 10-day period, Dr. New. What the Quebec is saying that someone who has lost their sense of smell, 10 days after, everything should be okay. But also in terms of a cough, if someone is coughing because they've had COVID-19 10 days ago, they would no longer be contagious after 10 days, even if they're still coughing. And also there's a lot of hubbub in Quebec about schools. We're banning sports right now outside of school for kids. They may be in a hockey team outside of school, but I'd like to know, in terms of the restrictions for extracurricular activities in schools, what do you think about that? Your first question was? Yes, coughing. It's hard to say. In general, what evidence shows is that if someone has fallen ill and has a range of symptoms, 10 days later, if the person is in good health with no symptoms, we can consider them to be no longer contagious. If someone is still showing symptoms with a cough, there should be another evaluation, a test done. It's 10 days later, someone may... Sorry, is that not Quebec's directive today? They're saying 10 days later, all the symptoms have to be gone, except for the sense of smell and the cough. They still may have a cough after 10 days, and they may be considered safe. That's what Quebec's directive is today. That's more of a detail. I think that science is still evolving on that. I understand what Quebec has done, and we've discussed this in general. We discussed this on the special committee, but from what I've understood, the situation continues to evolve. The data is still evolving, but I think that some symptoms may last longer. The sense of smell, the loss of it rather, may be there for several weeks. And that's part of Quebec's decision. And I think at the end of the day, it's tricky. I've already said this several times in English. It's a question of risk tolerance and risk management. Public health authorities in every province and territory and federally, we each all have our own mandates and responsibilities. We have to examine the situation and examine the evidence and make a decision for our own populations. So I respect what Quebec has announced today. They did examine the data and the evidence, and they said their policy after 10 days is that someone who may have a few symptoms may also be considered non-contagious and may leave isolation. Based on their analysis and evidence, that seems fine. Oh, in terms of sports, that's another issue. It's tricky. Everyone, and I think public health authorities in every province and territory in Canada, we have to look at what we can keep and what we have to ban. It's tricky. It's always important to have good discussions with the education authorities and health authorities. Another very important factor is the transmission rate in communities. We can always look what's happening in other countries, but if there's a high transmission rate of the virus in a community, it's not just up to the school, but also in restaurants and shopping centers. People may be getting contaminated with the virus. So that's another very important factor to consider. In terms of sports, that's a good discussion to have. It also depends on the nature of the sport. There are some sports that involve more contact for the participants than others, and there are also some sports that are more solitary. Football, for example, has much more contact than tennis. That gives you an idea of what considerations that should be taken into account by public health authorities. We know what the principles are. We have to look at social distancing. There may be physical barriers as well to see what we can do to keep some level of activity in our society. It's hard for me to say. We may be able to continue a sport in one region and not in another. We have to look at the best recommendations from local authorities as well.
Next question, Ian.
Ian Wood, CTV News. Dr. Tam and Dr. New, with regard to airline travel right now, just for clarification, international travelers arriving in Canada are directed to quarantine for 14 days at their final destination, meaning that if you land in Canada from an international flight, you can still travel on a domestic connection. And this is as opposed to countries like Australia, South Korea, for example, where when you land in those states, you are taken to a quarantine facility, whether that be a hotel or something. Is the quarantine still effective if we're allowing international travelers to travel on board packed domestic flights?
So I would just say that Canada has one of the most stringent quarantine measures around the world, and perhaps like Australia. What the requirement is, if you're symptomatic on arrival, you cannot move on. But if you are asymptomatic, and there's screening procedures, including a temperature check, you wear a mask, and you're taking a flight domestically to your final destination, that is our current protocol. We haven't seen any specific data to date to suggest that isn't a reasonable protocol. We would like people to get to the final place of destination and quarantine there, because for all sorts of reasons, I think that is a very reasonable approach. But all those layers of measures, including mask wearing, sitting down, don't move, face forwards, the ventilations on aircrafts, etc., are all there so that that particular journey in flight is as safe as we can make it, and then people arrive. So I think with any layers of measure, it's never 100%, but this is a very reasonable approach. But anyone with symptoms will be stopped at the site of arrival.
Just to add to what Dr. Tam said, one of the other important aspects of Canada's approach to people coming in, with our Quarantine Act is that people have to indicate that they have an isolation plan, that, that at their final destination, that they have a sort of a place that they can self-isolate, that there's no one else at risk, and so on. So certainly we've had individuals who've appeared at our borders and they don't have that sort of isolation plan, or there are other people potentially at risk at their final destination. And so those individuals have been put into federal quarantine facilities, sort of at the border or close to it. So,
but
Dr.
all
Tam
in all,
said,
we are satisfied with quarantine. People who need a quarantine going on domestic flights, we're satisfied with the regulations being taken right now?
yeah, with the layers of protection, yes.
Okay. My second question is still on airlines. I believe it was in June that the major airlines in this country indicated that they would be booking adjacent seats. They would not be keeping them vacant, and that has continued through the summer until now. And we are seeing aircraft that are fully loaded traveling in this country. What was the rationale behind the airlines? I know we talk about their ventilation system being so excellent, but what is the rationale behind it's okay for people to not social distance and sit in, as you know, airlines the seats are very small, very close together. What's the rationale to give the airlines a break on not having to social distance their passengers?
So I'm not sure about giving them a break, because it's not our role to sort of implement those measures.
When I say give a break, I should say, we have directed restaurants across the country, stores, shops. We have made huge steps across Canada to tell all of our other institutions that they have to have people social distance. But apparently airlines don't have to do that. So I'm still confused about that.
So first of all, it's in anyone's mind, it's not very intuitive to think that airplanes are somehow safe, because they are enclosed. People are are close together, and so I think what we were looking at was, one, what is the evidence of spread in-flight spread? And there's been very few reports of an in-flight spread of COVID-19. It doesn't mean it cannot happen, which is why layers of measures have to be put in place to reduce those. In public health, we still advocate for physical distancing where you can, but if you cannot, the screening measures, not mixing passengers, try and sit very still, everyone facing in the same direction, seat back in front of you, mask wearing, hand hygiene, are layers of protection. Can we guarantee 100% protection? No, but it's many different layers of protection to reduce the risk. And I think, again, we haven't had a report in Canada of someone who acquired it during a flight. We'll still have to watch it, and we can still adapt our measures. Secondly, it's very important, I think, for individuals to examine their own risks, because I think if you are a senior, if you have underlying medical conditions, you have to sort of think about, well, where did you start your journey from, all the way to, well, exactly what you're going to do at the other end. From, taking public transport to arriving at an airport to going, all the way through the journey, you have to think through all the measures. Are you comfortable with the fact that those measures will protect you? If not, really think twice as to whether that journey or that travel is important to you. So there's a personal risk assessment on top of these layers of protection. And I've had very recent discussions with the province and territories about, enhancing notifications of positive cases. I think anyone who's traveled should continue to monitor the symptoms, I would say, for the 2 weeks. There is a website. We're going to try and make it more obvious to Canadians of which flights have had a positive case. Today, we haven't had any reports of a case that's been on a flight with someone. Doesn't mean we may not find one, but it has been very rare.
And sorry, just have either of you recommended
one question,
to the transport minister or health minister that perhaps airlines should have social distancing? Do you think they should?
I think everyone should attempt as much as possible to get the physical distancing. And I do someone's risk. And, if someone does have underlying medical conditions, if they have certain types of disabilities, try and find a right placing of that person on a plane would be, extremely welcomed, I'm sure.
Thank you, Dr. Tam. Next question, CBC.
Hey, David Thurton, CBC News. This is a question I've had myself and my colleagues are having as well. What is your guidance for people about wearing masks outdoors? And, what's the threshold of cases before you would tell Canadians to start wearing masks outdoors? Because right now it's just indoors if you can't keep, and of course if you can't keep the 6 meter distancing, and if not, you'll correct me on that.
Yeah, and as with any sort of assessment of risk for a certain setting, it's not a sort of straight number game. So absolutely look at transmission in your community. That's one thing. And have there been cases in your community, and are there lots of outbreaks, etc.? That's one factor. Two is outdoors is always better than indoors, so we keep recommending that. But even outdoors, I would say, are you able to control that environment to make sure that people are not sort of crowded together? And is it a place where you feel comfortable that others are going to respect those public health measures and physical distancing, except of course to your own specific social bubble? And if any of those things make you uncomfortable and that you cannot potentially physical distance, I would advocate people to wear a mask, and it would be an added layer of protection. But it's a sort of discussion that we actually have quite frequently at the chief medical officer's table is actually how do we enable Canadians to go through more of a risk assessment process than, here's a hard number that you should follow. But yeah, if you've got underlying risk factors, if you're not comfortable with your setup, even in the outdoor setting, there could be crowds that you can't control. Under those circumstances, I think, adding another layer of precaution is a really prudent thing to do.
David, follow up?
Yes. This is from one of my colleagues at CBC Montreal. They're seeing a situation in that in Quebec where a school that started yesterday has had to isolate 24 teachers because one teacher tested positive for COVID. That instance will seem very alarming to parents who are, either have put their children back in school or might be considering putting their children the next coming days. So is that case surprising to you, or is this just something that we should expect to see and we should be prepared to see as we head back to school?
Yes, so I think right now in Canada, in the vast majority of in Canada, the numbers and the rate of infection is actually very low. So that is a really key factor. And we will, and I would say that it is expected that we will get some cases in schools because the chances of having a case will be reflective of what's going on in your community. And so people need to be prepared with local public health on exactly what to do when you have a case. So having a plan is the most important thing so everybody knows what would happen if you did get a case. And that people won't be surprised and that they would feel reassured in terms of what will happen. So I don't know what that specific circumstances is, but I think that people should not have a massive knee-jerk reaction and just close everything, but have local public health examine that situation and provide that advice in terms of what to do in that instance. Many schools will have plans in terms of cohorting people in a certain pods or classes. What they will try to do is to limit the impact on that school by those kind of measures, those physical measures, those hygienic measures, the distancing measures, so that they could be as targeted, as precise, as surgical as they can in managing those circumstances. But I can also understand that there is stressful and is anxious for parents. So that requires a lot of discussion in those particular settings to make sure everybody is actually comfortable with those measures. But I think absolutely we're going to expect to see some cases as we have seen in other countries. The key is to spot those cases quickly, manage those small clusters, don't let them spread, and see if we can't adapt our protocols and live with the virus. And one other thing that I think is really important is to systematically collect some information about schools, cases in schools, whether they're acquired in school or outside of school. Right now, the data suggests that schools are not a major driver for, transmission in the community, but we have to actually get that data and see in the Canadian context. We also have to collect data on schools that have successfully opened, not just report on the ones that have had an outbreak, because you want to learn, well, what made that setting successful in terms of, maybe out of 2,000 schools, you hear of 2 outbreaks. And that isn't necessarily a course to blanket approach to everything. And we will learn a lot. And I think people, I would like to be able to get some of that information in a systematic way to inform policies.
Thank you. We will now turn back to the phone. Operator?
Thank you. The next question, la prochaine question est de Cormac McSweeney from City News. Please go ahead. Your line is open.
Yeah, hi, Dr. Tam. I'm going to go back to the international travel question for a second. Reuters is reporting that Air Canada is planning a voluntary COVID-19 test trial for passengers arriving in the country at Pearson Airport, and that they're looking at the tests, as have been mentioned in other questions. It would consist of a test at Toronto's Pearson Airport, followed up by 2 tests at home, and they hope that the data collected will convince the government to take a more science-based approach and end the 14-day quarantine requirement, or at least waive it and reduce it for people who have successful negative tests. I'm wondering, has the Public Health Agency been involved in conversations with the Airport Authority or Air Canada regarding this, and whether you would be actively involved in this specific test trial as being reported by Reuters?
Yes, so we are aware of the study, and it's linked to an academic institution, of course, McMaster University. And I think from our perspective, we wanted to make sure that the study is linked to public health, because obviously any findings, any test positives have to be actionable from a local public health perspective. So absolutely. And we are, of course, very interested in the result. And it's in line with some of the kind of protocols I think should be looked at. And just to emphasize that a negative test in this study or this approach does not exclude you from quarantine, but they will find, I think, good. Some of the results will be of interest to everyone in terms of, what actually happens on arrival, the middle of that incubation period, and towards the end in terms of the testing performance and the detection rates, etc. So I think that we all look towards those kind of results with interest.
Yeah, it's Dr. New. I just would add, I think I would probably take a little issue saying that Air Canada is pushing the government or whatever to take a more science-based approach. I would say we've been taking a science-based approach right from the beginning, and certainly we welcome, any studies that would add to the evidence base. The issue of doing tests for arriving passengers in Canada, I think everyone, including ourselves in Canada, we're seized with that, and we're very keen to see what the evidence shows us. Because, not to get too much into details, we know that it's possible that someone may be asymptomatic. It might be picked up at sort of upon arrival. It's always possible, and that's important to know. But we also know that some people might have been infected just maybe shortly before arrival in Canada. The so-called incubation period is up to 14 days. If someone comes to Canada and they were exposed 1 or 2 days before, they might have a negative test at day 0. But if they were to then have a test at day 7, when it's more likely that the viral load is higher, then they'll test positive. And that's all important information for us to know, so that at the end of the day, we can also look at the science and then make our best recommendations in terms of a risk-based approach. Because it's true that 14 days is what we're using as a limit for the incubation period. But it's possible that if the evidence shows that you get a very substantial proportion of people identified as being positive at day, let's say day 7 or so, that could also inform in terms of what might be considered moving forward. Thank you.
Thank you, Cormac. A follow-up?
Yeah, my follow-up is going to be based on the initial remarks from Dr. Tam at the start of this news conference around drug overdoses. You are sounding the alarm about the boost in drug overdoses that we've seen in many provinces, and urging those in power to explore all options to address the issue. And I think, as you touched on earlier in the week, or possibly last week, I don't know, time is all messed up in the pandemic at the moment, but it could include the possibility of decriminalization of drugs. So I'm wondering, has the Public Health Agency itself done any studies about the public health impact of decriminalizing drugs? If so, what has it found? If not, will it? And you've been meeting regularly with your provincial counterparts. Has decriminalization of the possession of drugs come up in your conversations, and what's the feeling amongst your provincial counterparts?
So I think you're referring to a previous press briefing where our minister was also there, and I think at this point the government of Canada is not considering decriminalization of these substances, and what I was urging was that it is perhaps a difficult policy discussion. It needs societal debate and discussion. It is one element of, a potential multi-layered approach to addressing the opioid crisis. We've heard the Canadian Association of Chief of Police and their perspective, and I do think that the change or shift in the prosecutory guidance, which is moving towards not prosecuting anyone, with a simple possession of drug, unless there were some very specific moves towards, one step in the direction. But that we mustn't forget the multi-layered approach with harm reduction, opioid-assisted therapy, wraparound supports, and everything else that needs to be done, because that is, not in and of itself a magic bullet, but it does, shift, I think, everybody's thinking from a criminalization approach to one which is a public health approach. And I think the public health approach is the right approach. And we should all be working towards that.
Thank you, Doctor. Next question.
There are no further questions. Il n'y a plus de questions.
Thank you. We'll turn back to the room. Kelsey?
Thank you. My question is for Dr. Tam. Dr. Tam, there still seems to be a very high degree of anxiety amongst parents and teachers ahead of the return to school, in part because nobody seems to know what the new routine is going to look like. They don't know what the new classroom is going to look like. They don't really know what they're supposed to be doing at home still before they go to school. And my question is this level of anxiety normal? Should parents be this scared? Or is this just a response to the high degree of unknown that seems to be floating around still around the return to school?
I think it is absolutely normal to feel stressed. I think, you're talking about your kids. And I think as from the evidence perspective, we've been trying to communicate what we know right now about illnesses being less severe in children, and younger children, as far as we know, may not be the key spreaders or not as ready to transmit as adults. But we're still learning about this virus. I think, the level of activity of COVID-19 is under manageable control. We have quite low levels of illness. But that still doesn't necessarily negate all the myriads of questions that are floating through someone's head before school. So I think it is important to have those dialogues and questions answered under your specific circumstances. I know that given more support is needed, I believe the Prime Minister made an announcement just to provide more support to schools so that if there was more to be done, they can utilize that funding to do so, to make the environment physically safer, to look at how you can provide more maybe technical support for kids. It's also important, I think there'll be many perspectives. I think if you're a parent who are working, if you are a parent who have children who have a specific need to be back in a school environment, you might have a very different perspective. And many of those parents will want to be physically back in school, but they will want to be, know what the routine is, etc. So I think in talking to some of my colleagues is, what you want is every school to have a plan, and for people to actually know what that plan is. That will reduce the level of anxiety. I do think that people should expect to come across cases in the school year, because this is inevitable. But to know exactly what happens when a case is identified, that should also reduce the amount of questions. But it is tough to work through. It's a complicated decision, and there's personal choices also in that. And so I think is expected that this is a difficult decision, and that carefully weighing the risks and benefits and having those discussions is of paramount importance.
And then just as a follow-up on a different topic, it came out this week that the CanSino vaccine trial is not likely to go ahead now because of various disputes. What does this mean for Canada's vaccine response? Is there other projects that we're looking now to partner with or work on or collaborate with, given CanSino doesn't seem to be going ahead anymore?
Well, I think the sort of optimistic outlook is that there's so much research and so much development in this field right now with, definitely over 100 candidates, and now I think at least 8 in phase 3 clinical trials. I think all of you would have heard earlier about, I think, Minister Anand on the purchasing arrangements with at least 2 of the front-running candidates. We're continuing to pursue all of those avenues, both internationally and domestically. There is one clinical trial that's, within Canada with Medicago. So absolutely continue to pull out all stops. I was actually very heartened to see the positive results in older adults coming out of the Moderna vaccine, which is one that we are looking at very closely and has entered an agreement with. So I think I have been sort of keeping a sense of realism in the Canadian context of, you might not expect this vaccine for quite a few months, but we have to keep reevaluating that situation. And, we may be looking at more than one vaccine. So I think that, I guess the bottom line to your question is, yes, we sort of keeping all of those options open, and we'll continue to do so.
Thank you.
Thank you. If there's no more questions in the room, that will be all for today's press conference. Ça sera tout pour aujourd'hui. Merci.